We'll begin. Hello, good evening, everyone, and welcome to today's session. My name is Suchitra Kamath, and I'm the president of Inspiring South Asian American Women, also called ISAW. ISAW was founded in 2017 to create a platform for South Asian American women interested in greater civic engagement. At ISAW, we are driven by a single mission to empower South Asian American women. As part of our mission, we strive to increase awareness on issues impacting the South Asian American community, especially women. We help mobilize South Asian American women to increase their involvement in public service, and at the end of the day, diverse voices only strengthen democracy. Coming to today's topic, unfortunately, the novel coronavirus or COVID-19 is familiar to everyone, at least by name. As an ethnic group, South Asians are at greater risk, not because everyone else is, also because South Asians have a higher risk of diabetes. But I don't want to say much on this topic because I'm not the expert, and we have the experts here with us tonight. And I'm so delighted to see the stellar panel and our equally stellar moderator. Before I introduce the panelists, I want to give our contact information. Our website is isawnj.org and our email is isawusa@gmail.com. We are a nonprofit, so please consider making a donation to our organization, and you can reach us offline for that through our website, which is isawnj.org, or the email isawusa@gmail.com, or through Facebook. Our handle on Facebook is facebook.com/isaw.official. We are a 501c3 organization, which means all donations are tax deductible. I also want to acknowledge the donation made by Dr. Sunil Parekh. He's the president of SSAI, which is Sight Saving Academy of India, and he's a leader in the COVID task force in the South Asian community, as well as to our executive sponsor, Aisha Hamilton from Hamilton Law. So welcome all. Without further delay, I'm going to introduce our first panelist, Dr. Deborah Carnavata. Dr. Deborah Carnavata serves as Governor Phil Murphy's Deputy Chief of Staff for Outreach. Her work focuses on the governor's priority to have close connectivity to the people we serve so that decision-making at the highest levels of government is informed by their experience and expertise. She, along with her team, work extensively with advocacy organizations, constituent group, grassroots organizations, and labor. Deborah has a BA from Dartmouth College and a master's and a PhD from UCLA in the anthropological archaeology, where she was a Fulbright and National Science Foundation scholar. Deborah is the president of the Board of Trustees of the East Brunswick Public Library, where she has served as a trustee for 10 years. She lives in East Brunswick with her husband, Irwin, and 3 children. All are home now because of COVID. Growing up, Deborah lived 3 wonderful years in India that shaped her worldview and love of the country from her first trip when she was 3 years old. Ladies and gentlemen, Deborah Carnavata. Our next panelist is Colleen McKay-Warden. Colleen McKay-Warden has worked in various public health environments for 23 years, including nonprofit voluntary health organizations, local and state governmental health agencies, and currently an academic institution. In her work as a public health practitioner, she has successfully led, facilitated, or participated in numerous aspects of the profession, including community health needs assessments, workforce assessment and training, quality improvement, emergency planning, health education, health promotion, and grants management. Colleen is currently a project director for the Rutgers School of Public Health, Center for Public Health Workforce Development. Colleen and her colleagues at the School of Public Health developed the training curriculum for the New Jersey COVID-19 Contact Tracing Corps, which trained and deployed over 900 contact tracers around the state. Colleen received her bachelor's degree from Rutgers University in social work and her master's degree from Montclair State University in health education. Please welcome Colleen McKay-Warden. Our third panelist is Devangi Patel. Devangi is the Deputy Health Officer for the Montgomery Township Health Department. She earned a Master's of Public Health and Health Education and Behavioral Science from the University of Medicine and Dentistry of New Jersey, a Bachelor's in Psychology from Rutgers University, and is a Master's Certified Health Education Specialist. She has previously worked as a Breast Health Outreach Coordinator for Somerset Medical Center, as the New Jersey Outreach and Quality Coordinator for Policy Studies Incorporated and Maximus Incorporated, and for the United States Department of Commerce and Statistics, Bureau of the Census. Her areas of interest and expertise include chronic disease prevention and management, mental health and wellness, Health Education and Community Engagement Program, Planning and Digital Public Health. Devangi is the president-elect of the New Jersey Society for Public Health Education. She coordinates the public health education program and national public health accreditation activities in varying capacities for the Montgomery Township and through public health shared service agreements with Princeton, Branchburg Township, Hopewell Borough, Pennington Borough, and Rocky Hill Borough Services. Please welcome Devangi Patel. The remaining of our panelists and our moderator will be introduced by Kiran Gill. Kiran is an ISAW board member. She has been the past president for ISAW, and she is also a past CEO and president of PARS Environmental. She's currently the executive director for Sikh American Legal Defense Education Fund, also called as SALDEF. Kiran, it is all yours.
Okay, thank you so much, Suchitra. And I'm so excited about this, the panelists today. We have some incredible panelists. Our next panelist is Dr. Hethel Gore. Dr. Hethel Gore is the medical director of her own practice, Woman's Owned OBGYN in Englewood, New Jersey, where she provides comprehensive gynecological care to a range of patients from adolescents to women facing menopause. Dr. Gore has leveraged her training to champion women's rights, in particular reproductive rights, through her show on ITV and talk shows. She's been appointed to the New Jersey Office on Minority and Multicultural Health Advisory Commission. So we're excited to have Dr. Hethel Gore. Our next panelist is Dr. Varsha Singh. Dr. Varsha Singh is a healthcare leader in New Jersey and is a neuroscience nurse practitioner and stroke program manager at St. Joseph's University Medical Center in Paterson, New Jersey. She's a neuroscience specialist, especially in the area of stroke care. She's a member of the New Jersey Stroke Advisory Panel and now on the World Stroke Organization. She serves as a director at large for ANA, American Nurses Association, which is a national organization serving 4.4 million nurses, and was recently appointed on INCNP APN Network Communications Group, which serves nurse practitioners across the world. She is also on the board for SATI, South Asian Total Health Initiatives, and SSAI, Sight Saving Academy of India. She was nominated for the New Jersey Healthcare Hero Award in 2012, and she also received the March of Dimes Nurse of the Year Award in 2015. She's a Kellogg's and Jonas Scholar now appointed on Jonas Alumni Council. She received the prestigious GOPIO Community Service Award in 2020, and was also inducted as a 2020 fellow at the New York Academy of Medicine. Most recently, she developed a new program for self-care and created workshops that will guide people to manage their conditions through an integrative approach.
Thank you, Kiran.
Absolutely. Thank you for joining us. Thank you for being with us today. And now I'm very pleased to introduce our wonderful moderator, Freeholder Santhi Nara. Middlesex County Freeholder Santhi Nara chairs the County Public Safety and Health Committee. Since she joined the board, she has maintained a strong commitment to provide the residents of Middlesex County with programs and resources that will ensure their safety and address their health and wellness needs. Freeholder Nara is a longtime North Brunswick resident and a graduate of Georgetown University and Georgetown University Law Center. Currently, she's a practicing attorney with the Legal Aid Society of New York, where she is a supervisor in the Criminal Defense Division. Freeholder Nara is an active member of the North Brunswick Township Committee Emergency Response Team, CERT. She's trained in search and rescue, fire safety, disaster medical operations, and received specific training from the Red Cross in shelter operations. She participated in running shelter operations in North Brunswick during Superstorm Sandy and the 2015 warehouse fire. So we're so happy to have Freeholder Santhi Nara moderate this session. So I will turn it over to you.
Thank you, I was muted. So I'm really honored to be hosting this panel because the women on this panel are incredible. You all have a breadth and wealth of training, experience, and education that I think is going to make this a very, very dynamic discussion. So let me start off, and I'm going to ask each of you, I'm going to go through, and I'm going to ask each of you to talk a little bit just generally about your life experiences as they are relating to everything that we're going through right now in the pandemic. Because, you know, all of you are well educated and you have experience in the health and medical field, but this is an unprecedented situation we find ourselves in. So if you can just tell us, you know, what your experiences during the pandemic have been and how they've intertwined with maybe some of you I know have had personal experiences, but specifically your personal, your professional experiences in healthcare. So I'm going to start off with Colleen, if you don't mind.
Sure, sorry, I was expecting Deb. Sorry, thank you so much. It threw me off, but okay. Thank you so much, and good evening, everyone. It's really a pleasure to be here, and thank you for inviting us. Shanti, would you like us to do our full intro right now? Is that okay? Do you want to go with that? Okay. So again, thank you for inviting us. We're really looking forward to this evening's program. My name is Colleen McKay-Wharton, and I'm the project director at the Rutgers Center for Public Health Workforce Development. And we're based at within the Rutgers School of Public Health. So much of my activities for the past several months have been related to contact tracing. So just briefly on a background of contact tracing, you know, public health professionals have used contact tracing for well over 150 years, right, in terms of working to contain the spread of communicable disease. This is really a critical function of public health, and especially right now and in situations where there is no vaccine or there is no really effective treatment yet available. Contact tracing is really something that's been relied upon in public health to help contain the spread. So, you know, clearly this is something that has been a very critical task in the last several months, as well as the previous 150 years. But public health professionals have been working tirelessly, you know, since the onset of COVID started spreading here in New Jersey. But in late April, the School of Public Health was asked to develop a curriculum to help train what was called the New Jersey Contact Tracing Corps, you know, to help train a pool of individuals who would be hired to serve as contact tracers who could help supplement really the public health activities that were happening in local public health agencies around the state. Clearly, they were bombarded with thousands and thousands of cases that no matter how great the workforce is, that's a lot to manage, right? And we really needed a core of additional individuals to help with that process. So the goal of the training was to provide just a solid foundation for these tracers in, you know, what does contact tracing actually mean? What are the activities associated with that? How do we go about implementing something like that? And the training consisted of 6 modules, and it would take about 25 hours or so for individuals to complete. And I can talk a little bit more about the content of that training a little bit later, and I'm happy to share some of the details of that. But for the moment, I'll just share that, you know, it addressed really the foundations of what public health is and what the public health infrastructure is like in New Jersey, so that the contact tracers could understand how they fit into this process, right, on the statewide level. What was their role going to be to help supplement the local public health departments? We addressed communication skills, cultural humility, cultural competence, obviously the signs and symptoms of COVID, how the disease is spread, quarantine, isolation, of course, all of those sorts of things. We addressed you know, really taking note of populations that would seem to be at greater risk or having greater impact as a result of being exposed to COVID or having access to testing. So this training was completely online, and at the completion of that 25-hour training, we would bring the cohorts of trainees together to answer additional questions, to talk about next steps, to make sure they were clear on what their role was. Let me just mention the other critical piece of the training was understanding the database that would be used to do the contact tracing. And in New Jersey, that was a new system that came up and live online really just a short time before the training began. So, you know, these individuals that we were asked to hire and train, by early June, we had started the hiring process of about 1,000 individuals. In addition to the contact tracers, we hired 21 social support coordinators who would serve as social workers in each of the 21 counties. And they would be there really to assist individuals who were impacted by COVID, but maybe had some special needs, maybe they weren't able to quarantine at home, or if they had to quarantine, maybe they didn't have the financial resources they needed to support their family if they're the sole breadwinner. So these social support coordinators were really there to help address some of those social needs that individuals may have had as a result of the disease. So after the individuals were trained, they were then deployed to local health departments throughout the state. And we can share more in a little while about that formula and how that process worked. So as a health educator for the Public Health Center for Workforce Development, and together with my colleagues at the School of Public Health, my role in this was to develop the curriculum and research the content that should be incorporated in this. As you heard earlier, I have a master's degree in health education, an undergrad in social work, and I've worked as a public health educator for about 25 years. You heard earlier what that background looked like. So because of that background and because of the education I brought to this process, it's just sort of a natural role for our department and for our team to be working on this. This is a very natural activity for us. Our primary functions are to continue to provide essentially continuing education for the public health workforce in New Jersey. So it might be health officers like Devanji, and maybe health educators or epidemiologists or inspectors or public health nurses. And that's really the primary function of our department. So I'll leave it at that, I think, for now, if that's all right, Shanti, and then we can.
No, that's wonderful. And Colleen, okay. I think that, anybody watching this, or whether it's live or they watch it later, we should all be grateful in New Jersey because we have these wonderful institutions, but especially Rutgers.
Oh, thank you.
Cutting edge public health policy group. I mean, we are very lucky.
Thank you. Thank you. We're very proud of the work that happens there. So.
You should be. And as someone who lives nearby,
thank you. I heard you're right down the street. Thank you.
I've always been grateful for the resources we have here in New Jersey because of institutions like Rutgers. And so, Deborah, as our representative from the state, I know that that has also been something that the state has relied heavily on. The experts that we have in our own state, cutting edge research, cutting edge technologies, everything here within the state that we now are being forced to bring to bear for our own residents in a way that no one ever imagined. So Deborah, if you could talk to the audience from your perspective of working for the governor and what is going on with the state and COVID, which is a big, sort of introduction question, but if you could.
Thank you, Shanti. So honored to be here. So thrilled that you are one of my freeholders. We have such great representation in Middlesex, also very diverse representation, and incredibly proud about that. To Suchitra, Kiran, to Isa, thrilled to be here with such a great panel. As you can imagine, because I think everybody's experienced this, life in COVID, professional and personal, was turned upside down, inside out, and backwards. And what I think we've seen from government is the amazing resiliency, collaboration, and critical partnerships from our institutions, our elected officials, our constituents. And, we're so grateful for the people who are joining this evening because you have been vital partners in this work, all of you, each in your own way. And we couldn't do it without you, without your cooperation, without your participation, without hearing your voices, without you being willing to hear our messages. So these partnerships, to your point, Shanti, become so critical. Our ability to partner with Rutgers, with our county freeholders, with our mayors, with our county executives across the board. This is the time when it really shows how people do come together. What I'll say in government, for those of you with experience, know that it's a little bit like trying to turn a battleship. It sometimes can move slowly, but in an emergency, it picks up pace and figures out how to do things quickly. And so we've turned just about every resource in government for the better part of this year towards addressing the health crisis and the economic crisis that has come as a part of that. I think one of the things that we've seen across the board is the disparities in how this virus has impacted people, both in terms of health and economics. We see the communities of color, we see our essential workers who are predominantly communities of color and also disproportionately women bear a greater burden across the board. So it may be they're more likely to lose employment. It may be more likely to be essential workers that have to continue working while they're also trying to care for children because they're the primary caretaker for children at home. And by the way, on top of that, become their teacher because so much learning is done at home. And what we've tried to do through everything of all the actions we've taken is to protect public health first and foremost, but within that, respect the fact that our state is diverse in terms of our cultures, our religions, our employments, our levels of education, our geographies impact it, our needs, our access to healthcare and health insurance. And so we want to make sure that what we do tries to address that diversity. So blanket ways to protect public health, such as wearing a mask and keeping social distancing, are one step of it. But figuring out how do we support parents who have children at home and need to go to work because they're essential frontline healthcare workers or essential workers in parts of our economy that have remained open throughout, such as in a grocery store or in a gas station or in a daycare center. How do we make sure those parents and those children are provided for? How do we make sure people have access to testing and that it's easy and that it's not scary and that it's not dependent upon your citizen documentation, that you shouldn't have to prove that you're a citizen in order to take a test? How do we make sure you get follow-up health care and support? We understand that contact tracing, which we've put in across the state to support local healthcare departments in a ratio of population to contact tracer, can be very scary for people to get a phone call, not just to say that, by the way, you have this virus, which is scary enough, but now we're going to need to talk to you about who you may have come in contact with and who also might be sick. These are not normal conversations that we're accustomed to having. But what I will say is that through types of conversations like the one that we're having this evening, people become informed, and with knowledge, we decrease fear. And when fear is decreased, we can make better choices for ourselves and for our families and for our communities. So that is why one of the things that I've had the honor to do the most of is to participate in events like this, to address and answer questions, to try to make sure that people understand that we know there's fear and we understand that, and that we know that there are reasons within your family structure and your community structure that what we're asking of you is not normal, right? We're celebrating in the Jewish world tonight, Yom Kippur, where people get together and pray. It may be a Diwali celebration. It may be an Independence Day parade. All of these have to look different. And we're asking a lot of people and communities to do that. But I will just end with saying that what we have seen is such tremendous resiliency, collaboration, and energy to put together events like this, to talk and to share, because we're confident that as long as we're transparent, as long as we share information, offer to answer questions, we will get through this together. And because of everything that everybody's done, and the governor is so grateful to that, we are now one of the safest states in the nation for COVID. We're not out of the woods. We have the flu season coming. We have we have peaks coming up in certain places. We're working very hard to contain, but we've come a long way together, and we know we will continue down that road together, embracing everything that New Jersey is, which is united in a terrible situation, but also diverse in the ways that we handle it and respond to it. And we want to respect and acknowledge both, and we're so grateful. So thank you, Shanti.
No, I appreciate that so much, Deborah. And I think that open communication is the best way to handle any crisis, and getting out information and being open to listening to questions and letting people understand that no question is stupid, right? We're in unprecedented times, and people, we should empathize with where everyone's at in this situation and be open to all questions across the board. And so, Devanji, I'm going to come to you because what we mentioned is Colleen was talking about what Rutgers is doing in terms of training contact tracers, and Deborah was talking about the state's plans. But then it comes down to from the state level to the county levels and interacting with the towns. So I would love it if you could talk to us about, as a deputy health director in in Montgomery Township, if you can talk to us about how all of these things come down to your level of dealing with the community and actually within the county.
Sure. So I've been in COVID-19 preparedness mode since January. We were monitoring and looking at what was happening in China, but our preparedness activities started earlier this year, and we started getting together our first responders, school district, community leaders, and talking to them and providing guidance on what to expect. And this was before we even had any idea that a lockdown would be taking place. So, we were lucky in Montgomery Township that we were able to get everybody on board. And I know in the beginning, people were questioning, our meeting, saying, why are they making such a big deal out of this? This just seems like this is a flu. And, quickly enough, people started realizing this is going to get ugly soon. And, we were lucky in the sense that we had a lot of our educational materials and, messaging to the community, right before the lockdown. So people, knew about this and what was coming their way. It was NCOV at the time, but now it's COVID-19. And since the lockdown to right now, we've been focusing on, it's been COVID-19 response mode for us, focusing on identifying cases, coordinating contact tracing, and as Colleen had mentioned, working with Rutgers to do contact tracing on a larger scale. We local health departments, we only had one public health nurse and a part-time public health nurse to help us, but now with COVID-19, we realized we needed more help. And we were lucky that we were actually onboarding Rutgers nursing interns, and we were able to train them quickly, and then also onboard other Rutgers public health students as well. So if it wasn't for that support, we wouldn't have been able to get through the beginning stages of what was happening in March. And I anticipate, and I would say that, all the other local health departments were in the same position, trying to build up their capacity and making sure that there was enough, staffing resources to handle this, because it was getting bad very quickly. And, once we started case investigations and contact tracing, it was very important to stay on top of all of the information coming out from the CDC, from the state, from the governor's office. And, many times, it wasn't enough even just to post the governor's executive orders or the CDC guidance. We had to summarize it. We had to simplify it and make sure that our community stakeholders understood what was expected of them. And we continue to do that. But, the other side of case investigation and contact tracing at the local level is you learn more about people and what they're going through. We hear about almost every positive case and close contact that is identified, and we learn about their stories. And, I've heard stories from friends and family and the community that I'm serving, people who've experienced and they continue to experience unimaginable loss and impacts of this pandemic. And it's frustrating for us at the local level because we see this, and, we wish that we could sort of, project it, on a more wider scale so people know what's going on and what we're seeing. Like some examples, we forget about people that work multiple jobs and that have to take care of their little children. Now that school's starting, some people are struggling to find people to take care of their kids so that they can get back to work. We also are hearing about people that have had to quit their jobs because they couldn't find a better solution for childcare and also to help their kids through schooling while it's virtual. The other thing is people who, it takes a long time to recover from this for many people. And we've heard of cases where people have lost their jobs because of this, and, being fired for being out sick for too long, or people that are working multiple jobs and they're afraid to get tested because they're afraid that they're going to have to quarantine, and they have nothing to fall back on. So there's a variety of stories that we hear about, and we know how important it is that we continue to work and do and help the community and focus on those people that really need those resources. And it's been amazing to see Montgomery Township come together to help. And there've been a variety of community partners, students, residents coming together to raise funds, to donate essential items. And we started a Montgomery Together webpage to just focus on the positive side of that, of how we can help and what we can do to help those that are really suffering and that don't have a voice. So a lot of times we don't find out about what they're going through. And then, just to close, public health officials at the local level, we have been working nonstop. It is very difficult to take a few days off, but we realize we need to do that to recharge. And I know I'm speaking for all local health departments out there right now. But people need help. Schools have a lot of questions, business owners have a lot of questions, and they need assistance. And local businesses, providers, every time they see a patient or a child who's now going to school, they want to make sure that they're getting their answers right away. So it's important for us to be there for them, and we will continue to be there. And we're in the midst of our flu clinics right now, and I'll be talking about the twindemic and what to expect in the fall.
Thank you so much, Devanji. And I'm going to come back to our public health officials, but I'm going to now focus on our two medical professionals and to talk to us about something that Devanji touched on about what's happening in our hospitals, in our different health institutions with people who have contracted COVID, and what the long-term consequences are that they've seen, and just your experiences during this as medical professionals, frontline workers. So I'm going to start with Hethel, my fellow board member, Dr. Hethel Gore. So Hethel, can you tell our listeners what this COVID period has been like for you as a doctor, an OBGYN right on the front lines?
So thank you firstly to Isa and all esteemed panelists to take time out on a Sunday evening. As an OBGYN, as a practicing OBGYN, we work very closely in a very close spaces, be it operating room, be it labor and delivery, and you are in that room for hours sometimes. So even though we had some, since February, I've been talking on my show as well as other TV shows about this COVID-19 or novel coronavirus, and we've been talking, but we didn't have a lot of information at that point, right? And even though we took precautions, I did get it in early March, and I did suffer from COVID. Luckily for us, though, as an OBGYN, the disease has not impacted pregnant women as much as we would have anticipated, because they are immunocompromised, their immunity is down. So that has been a really good kind of observation, as well as people who are immunocompromised because of the medication or because of having, say, cancer, etc. They haven't been affected as much. What we have seen that high-risk population are definitely the elderly, definitely people with comorbidity. Obesity has come out to be one of the most important kind of like a marker where people have had bad outcomes due to COVID and obesity. Hypertension, diabetes, these are some of the kind of risk factors. And we as a South Asians, we have a really high incidences of diabetes, about high blood pressure, cardiovascular risk factors, obesity, etc. So we as the South Asians, that's why we are a little bit at a higher risk of COVID because of this risk and comorbidities that I mentioned. Apart from that, a lot of us are still in a very joint family module, right? And that's why the South Asians come out to be a little bit different, because we are living with our elderly people, our elderly folks, younger 2-3 generations staying together, 2 brothers along with their kids and their parents living together. So we still have that joint family module, even in United States, where compared to the other ethnicity where the parents live alone or the parents are in nursing home or long-term care, we Indian South Asians, we tend to keep our elderlies in our home. So that puts a big challenge to COVID. So these are the few factors for South Asians that we should keep in mind: comorbidities, the family structures, as well as the other factors which makes it at higher risk. So I'll touch upon the other things as we go along, but those were the few highlights as a clinician that I wanted to make sure that our listeners, our viewers are getting that kind of important, as well as the policymakers, because we are slightly different than the regular, folks. So there is this family dilemma, the social dilemma, they have to take into consideration while they are making policies.
Thank you so much, Hethel. I appreciate your comments, and right before we started the panel, I had actually raised that as an issue that's slightly different for our communities, the large family dynamic that we have. So I'm going to now ask Varsha Singh to address us and and talk a little bit about her experiences. And I know she has a wealth of experience in all different types of healthcare situations. And so if you can talk to us about what you have seen going on within the medical community during the onset of COVID. Varsha, I'm sorry, you're muted.
Yes, thank you so much, Shanti. As I'm listening to all our esteemed speakers, I'm actually having a deja vu kind of March till now. March 6, I remember the date, COVID patient, and the hospital acted promptly. I'm really proud to say that I work for one of the best health systems in the state of New Jersey. I work for St. Joseph's Health System. We have seen COVID patients from March 6 as healthcare providers, as a nurse practitioner. I just want to say that this year, 2020, started as Year of the Nurse. And yes, it proved. It turned out to be Year of the Nurse. All nurses were healthcare heroes, and they are. And representing that group nationally, as well as state, I represented nurse practitioners for the state of New Jersey. I'm past president of Nurse Practitioners Organization in New Jersey. And from everywhere, I heard that everyone stepped up. Everyone was resilient. Everyone adapted to the new system. And they pitched in. They took care of the patient. They went above and beyond. The biggest issue that we faced was how are we going to get PPE? But we survived. We did it. Our patients were treated with quality and care. So here when I'm talking about the South Asian community, I not only experienced COVID, and even I'm experiencing now, not only as a healthcare provider, as a clinician, but I also experienced it as a South Asian woman, a family, my family whom I could not meet for their birthdays, for the festivals. Raksha Bandhan, a very big Hindu festival where you go to brother's house and tie Rakhis. We have a really great value for that. We did that over Zoom. The birthday parties were over Zoom, festivals were over Zoom. But again, when I look at the South Asian community support, in my hospital, I saw South Sight Saving Academy of India stepped up. IT Serve, which is an IT organization, stepped up and they delivered meals to all the healthcare providers. This is another aspect of COVID. That's my experience. While we were providing care to all our patients, these organizations, they thought about the healthcare providers. So this is our South Asian. I think every South Asian will agree that they love to feed. So they found a way to feed all the healthcare providers. Second thing I would say that they did not just stop there. They started spreading information, educational materials. I saw Zoom meetings after Zoom meetings where these groups were educating communities and families. And I kept thinking about only two things. Every one of us, regardless whether we are South Asian or American or from any country, there are two things that we need really right now. We need to be smart, one, and we need to be patient because this pandemic is challenging us. If we lose our patience, we will lose against COVID. And if we are not smart, then we will lose against COVID. So when I talk about these two things to my patients, I just tell them, and this is for everyone, I said, remember one thing. I will teach you only one thing. And this is what I want to share with this group who's listening. In hospital, we observe the standard precaution. Assuming everything is contagious, we wash our hands, we wear masks, we don't PPE. Now this is going to everyone's house, assuming every person you meet is contagious. So wear your mask, wash your hands, and going back to what we have always said, cleanliness is godliness. If we just stick to that principle, and this is what I have been talking to all my patients, my colleague, when we meet in the lounge, hey, 6 feet away, this is me. Even when we are wearing a mask, we will say, this is me. We have a new norm. We are always wearing masks. So my new identity, right now in front of this camera, I'm me, Varsha, but at work, we all are in masks. We know each other by eyes and how we remember each other from our previous state. But we can deal with it, and only we can resolve this if we work together. And going back to Colleen and Devangi Patel, public health nursing is going to play a significant role, even for South Asian community. And I just wanted to share that we have a great resource within New Jersey. New Jersey State Nurses Association, they have such great resource, and there are many South Asian nurses in that organization. So now we have an opportunity to network, bring them on board, and let's get together and work together. And I know that there is COVID task force in every hospital. So maybe we need a South Asian COVID task force where we can work under one umbrella and bring South Asian community at a platform so that we can have only one aim, that we want to drive this COVID out of this country.
I appreciate those ideas and those remarks very much, Varsha, and I agree, because I think Colleen mentioned it too, and also Deborah. We have such a diverse state, and when you have populations from so many different backgrounds, whether it's religion, cultural, we also have to realize that has to inform how we go about sharing information and reaching out to communities. And I think everybody here, we all have the best of intentions. But your idea about the South Asian specific COVID task force is a great one. So let me ask you all, I'm going to ask each of you if you have something to say on this issue, but what would you say are some of the common misconceptions regarding our current situation with this pandemic that you see in New Jersey and generally, or you may see specifically within the South Asian community? So I'll just go through the whole panel. Deborah, could you address that?
I think most concern to me right now is what we hear with regards to concepts of herd immunity, that somehow it's been there a lot, and so we're probably immune, that the COVID is deadly. People seem to think that maybe catching it won't be that big a deal. That's a problem, because the high age group of people getting it right now are 18 to 29-year-olds who have a habit of thinking somewhat along the lines of immortality and being invincible at that age, which is natural. They also tend to have higher levels of they tend to have fewer of the comorbidities that make it more dangerous, so that they're more likely to have a less severe case, but they can be just as contagious. So they can bring it home to someone in their family who is immune compromised. They can bring it home to someone who is elderly and more susceptible. But those are two of the ones that concern us right now a lot, because it leads to careless behavior. And to Varsha's point, we have to stay kind of vigilant and patient and assume that everybody we're coming in contact with could be COVID, or frankly, we should assume that we could be COVID positive, right? And we don't want to share it. So those are two pieces that we're really working hard to talk to a lot of people about, to make sure that they understand that it's as dangerous as it's been, that we have to make sure that we're vigilant in the safety precautions, and that there is no herd immunity amongst our population right now.
Thank you for those remarks. Colleen, yes.
Yeah, I couldn't agree with Deb more. And the first thing I was thinking about was the the younger age bracket who, you know, there's this sense that, oh, it's only people who are grandparents, only those in there, as if those lives are less valuable anyway, which is a different conversation. But this belief that somehow, oh, if I get it, it's no big deal. It's a cold, I'm healthy, I'll bounce right back. And that may be true for many people, but particularly in communities where there are extended families living under one roof, that's not the way we can look at it. We can't look at this disease as only how it affects me. We can't, right? It's far too communicable. It's far too infectious that we have to be thinking about, I may be fine, but where am I bringing it? Who am I exposing? So that in particular is a real concern. The other thing that has actually kind of struck me, because I was out somewhere last evening, is I think, you know, with the lessening of restrictions as restaurants, you know, as we begin to open up a little bit more, which of course we understand the importance of that, I think people are getting a little bit lax. You know, I think we are starting to be a little too nonchalant about, oh, you know, it's all getting better. It's still here, you know, and I think people are letting their guard down a little bit. And I think we can't stress enough the importance of that vigilance that Deb mentioned, that it's really not a whole lot better than it was before. And once we all start interacting again, there's a very real possibility that these cases will continue to spike. And of course we see that in other states, right? And that's why we need to be wary of that and maintain vigilance and be consistent and always have your mask on and always be cognizant of social distancing. So those are kind of the areas that I'm
thank you. Well said, Colleen. And Varsha, I know you had wanted to say something on this topic. Please.
I just wanted to say that there is a myth also that people think that they don't want to wear mask. I'm not going to be afraid of COVID, right? And there are some people who wear mask diligently. Some people, they don't. They think I'm not going to be living in fear. There is also a little bit of confusion about why should I get tested, and what if I'm negative, what if I'm asymptomatic. I think I have this website that I'm looking at right now. It's at NJ Health and CDS website, which actually gives a really nice diagram. It's a tabular form which talks about time frame for self-isolation / quarantine based on testing result. So it clearly says if you are asymptomatic and if you are negative, what you should do. If you are asymptomatic and if you are positive, how you should quarantine. If you are symptomatic and positive, if you are symptomatic and negative, how you should quarantine. I think everyone should look at this website because it's very clear. What should I do? And that's where everyone who's watching this, ask this question to yourself. Self-responsibility, social responsibility. Are you going to take responsibility for someone getting COVID just because you didn't take precautions? I mean, I am not going to take that responsibility. I'm going to mask. If I have to do it for 5 years, I'm going to do it. Even if one person got infected, it's not going to work for my conscience. Similarly, everyone has to think about that this is not an individual disease. All of us are in it together. We hear it from again and again. We are all in it together. So that kind of cohesiveness, we really need it in the community. I protect you, you protect me. So we have to really address those myths which are surrounding a certain social group. So we have to have this message in unison going to our community. Please understand that this is not going away unless there is a definitive answer.
Well said. Thank you. Hethel.
Right. I agree with whatever everybody has said so far. I think as we are relaxing some of the rules, as we are mingling out and in a common spaces, but I think it's also very important to educate people about where is more risk compared to everywhere else, correct? So like I understand psychological well-being is also very important, along with we taking as a precaution. So I think 6 months people staying indoor and has also affected a lot of youngsters and stuff. So we still have to look into that part of the equation as well. So what I feel is very important to educate people is, okay, if you want to meet in outdoors, meet outside in a park where there's a good airflow, where you can keep 6 feet of distance, compared to meeting indoors in a closed spaces. I think that kind of a differentiation, when you do, I think younger crowd tends to understand more, right? Because it's like you are giving something in for them, and then they'll understand why it is important, rather than say, oh, you have to wear a mask and you have to avoid. I think if we kind of educate them that, listen, I agree, it's been a long time that you guys have been indoors, but if you want to see your friends, meet in a park, go bicycling together, keep your distance, wear your mask, at least you'll be able to see your friends. I think that's something that we have to put it to our patients or our relatives, or as a policy, that try to be outdoors, wear a mask, limit your time in indoor spaces, be a grocery store, be it indoor dining. Try to do outdoor activity as much as possible. Wear a mask, wash your hands, keep sanitizing. If you are touching common surfaces, be very vigilant. So those are the points that I think we should kind of empathize and make sure we as a provider do understand the mental health, how it is affecting a lot of us.
Good point. Good point. Vivanji?
I just wanted to stress that, talking about misconceptions, there's, especially for, for people in our community who don't have a health background, talking about the difference between treatment and building up your immune system. There's there's a lot of misinformation out there about, Ayurvedic remedies. And, the other thing I wanted to talk about is misinformation that our community sees on WhatsApp. They very vehemently trust what's on WhatsApp. Sometimes I send messages on WhatsApp to my family because I hope that they'll take it seriously. And, maybe that's something that one of, our task force can do to create that messaging on WhatsApp. So that is being circulated. And we have correct information, accurate information in that. Because even in the beginning of COVID, right before the lockdown or during the lockdown, there was a ton of WhatsApp messages being circulated within our community. There were messages about, don't go to the hospital because you won't be prioritized. They don't have enough resources. Or, drink tulsi and, haldi and turmeric and, all these different Ayurvedic remedies to protect yourself and your family, but not stressing the importance of public health precautions like washing your hands, don't touch your face, social distance, mask, guidelines for, when our youngsters want to go and play cricket outside. A lot of them are coming back to households where they have their nanis with them. And so, people forget. And when the messaging out there's more about, the standard American sports, the people that are playing cricket or other sports might not take those safety messages and precautions that are being sent out through the sports associations in the state, because it's not relevant to their culture, their sport. So there are some nuances, cultural nuances that might not be addressed because of that. So it's important, to bring that up, and maybe that's again something that this task force can address.
Well, that's actually a nice segue into something else I wanted to address. We talked about it briefly before we got online, because there seems to be a rise just in anything these days in scams, internet fake sites, and different things that are attributing to, I think, some people's, confusion or misunderstanding about what's real and what's not in terms of COVID and actually what resources are available. So I'm going to open it up to the panel, and if any of you, have had experiences seeing how this has been affecting the larger New Jersey community or even the South Asian community, I'd love for you to be able to share that. I think, Colleen, you had mentioned that you're seeing reluctance among community members to cooperate with contact tracing, right? Or issues regarding their concern for privacy when they're being asked questions about their medical situation. So could you speak to those issues?
Sure, thank you. And the fact is, I think all of us, we tend to not answer the phone if we don't know the number, right? We all do this. And so that by default is a difficult process to begin with, right? Let alone, the fact is that even before we had actually begun the broader training process and, beginning the hiring process for contact tracers, we were seeing reports of scams happening out there. There's always someone who's willing to dive right in and think there's an opportunity to scam individuals. It was happening very early on. And I think, the message that we have tried to get out there and what we try to convey to our tracers so that they can be prepared and from the local health department and the immigration status. We'll never be asking for social security numbers. We'll never be asking other private bank account information. Those sorts of things, that alone was critical to get out, right? That sort of messaging. If we are fortunate enough that someone will pick up the phone, and answer, generally speaking, once the tracers can begin the introduction and build some, foundational rapport very quickly and say where they're calling from, I think that trust does develop fairly quickly. So there really is actually a fairly good response rate once the connection is made, right? Once the connection is made, it's getting people to answer the phone and getting them to trust that you who you say you are. But to touch on your point about HIPAA, that is definitely a conversation that has come up often. Why should I be telling you about this about my private information? You can't ask me about that. My health information is between me and my doctor, and you have no right to ask these sorts of questions. And I think what people don't realize is, one, we absolutely stress the confidential nature of this conversation, critical, and we prepare the tracers to maintain confidentiality at all costs. But it's also a function of public health. We are required by statute to do communicable disease investigation. And while HIPAA is absolutely critical in all areas of healthcare, the world of governmental public health is charged with the task of containing the spread of communicable disease. And so public health officials are required to ask these questions purely for the purpose of containing the spread of illness. So, we do prepare our contact tracers with those resources so that they can readily convey that and explain. Actually, we do have the authority to ask these kind of questions. We don't want to try to play it in that way. Really, we just want people to understand that your information is protected. This is completely confidential. Your information will not be shared anywhere. And really, our purpose is just to contain the spread of disease, pure and simple. And so we do need to sometimes ask questions that are uncomfortable, right? And that are very personal. So it's just important to be able to communicate that to individuals.
Thank you. And Varsha, I know we had spoken and you've had some experiences seeing different things on various social media sites we were discussing. I think you mentioned there was an issue regarding plasma donations and plasma donors. And so can you explain to the audience what you experienced with that and specifically in the community?
Thank you, Shanti. I would say don't trust everything that comes to you through social media, because being a healthcare provider, second, and a student in doctoral program under one university where they tell you only look at the evidence. Look at the evidence. Is it does it have enough research? Does it have enough evidence? So as a healthcare provider, I'm also really concerned about my patients. So every time I see a resource, I share it as much as possible. Very recently, very reputed group, but I received a text which had a list of donors with cell phone numbers, that these are possible plasma donors and they are ready to donate plasma to any patient. Please call this number. So they even had their cell phone number. Thanks to Dr. Sunil Parikh, who immediately responded me that this is a fake news. And that is something which is really a valuable information. And think about this, I'm a clinician, I'm aware of everything, and still I always ask, should I share this? Don't forward any social media without knowing that it has some base to it. It's from an authentic website.
Mm-hmm.
So my simple advice would be don't forward anything. The advices come from everywhere. Now, if we can look at the internet, it is full of information. It's TMI, too much information. So your best for the community members, the best source, they can start with their primary provider, comorbidity, and they can advise them properly.
Mm-hmm.
And then reach out to someone who is a great advisor. And I really said, thank you, Dr. Parikh. I did not forward it at all. And this is just one of the example. And then there are claims in South Asian community, such and such Ayurvedic product made, cured my COVID. We don't have any evidence. We don't have any research to support that. And you turn around and everyone is advising, do this, do that, take this. And then there are articles after articles. So best thing for us, if we trust our elderlies, our South Asian culture is firmly grounded in Ayurveda, 5,000 years of Ayurvedic medicine. But we have to take it with a pinch of salt. Not everything that comes to us on Facebook or in a text message or from any other sources than on CDC website or in a government website. You have to ask. You have to ask someone, get some advice before experimenting it on yourself. I think I made my point.
Thank you. And you know what? I'm going to connect that to Devanji because I got a message on WhatsApp. I'm from Andhra Pradesh, southern India, and we have a vegetable many people know as bitter gourd. In Andhra, we call it kakarkai. And according to this post, drinking kakarkai juice with a pinch of turmeric would make me invulnerable to COVID. So I wouldn't even need to wear a mask. And, if that's true, I'd love to see the research and see it vetted. But unfortunately, yes, we do see things, right? And just whether it's in our South Asian WhatsApp groups or just anywhere in social media, I think a good rule of thumb is to question, right? Healthy questioning in some form or another is always a good thing with anything in social media. And we'll just say before we get off, I know that several of you have resources and websites, and we will definitely share those on the ISA webpage because we do want to get as much information out and resources outside of this Zoom are wonderful. So for everyone listening, we'll make sure we get all of those websites and the different groups that are involved in this, whether they're from the state or from Rutgers Health or from different South Asian groups who've been working during this crisis. We will get those posted. Devanji, I don't want to leave you out if there's something that you wanted to address on this particular topic.
No, I think Deb had a comment.
So I'm gonna ask this question because I know many people, I'm not a doctor, right? I'm not a healthcare official, but I know in my circles, a lot of people have been asking lately and wanting to reach out to healthcare professionals and say to them, if somebody could talk on this panel, and maybe this is Hethel or Varsha or anyone, about what we're hearing about what long-term effects could come from a COVID diagnosis. Because, rightly or wrongly, we're hearing about all the people who are hospitalized and are going through horrific, experiences, staying in the hospital for a long time and what happens to them and how they're recovering. But I've been reading a lot about people who may have been asymptomatic or maybe have not reached a stage where they're hospitalized, but there's growing concern that they could have lingering long-term effects from COVID. So Can any of you speak to that? I see you nodding your head, Hethel, so I'm going to
Sure,
go to
sure.
you.
So Shanti, so not only as a physician, um, I've seen so many cases, and we are following some of them. And my husband, he works for a big institute, and they are doing multiple studies for different aspects of COVID. But as a patient, when I had COVID, and now I'm seeing almost 6 months down the road after getting COVID, what difference I'm feeling in myself. And I have collaborated with other people, and most of us have agreed that there is some sort of chronic fatigue which still lingers. You do get tired, you do get a little bit easily, you kind of feel like a wipeout still. The energy level are not 100%. Apart from that, some people have complained about joint pains. So we still don't know if this is a long-term effect or not, but there are studies which are following these patients very closely. Also, there are certain concerns, which there is a huge study going on right now about residual cardiac effect, how their cardiac functions have been affected, how their lung functions have been affected. So it's very early on yet to say what will be the cardiovascular kind of effect lingering, or does anything become like a chronic issue post-COVID, or lung damages or fibrosis. We still don't have a clear-cut idea about if it does, what's the percentage, what's the severity, but there are multiple studies looking into that. But what is the common factor that so far we know is feeling tiredness, feeling like a wipeout, the energy levels are low, and some joint pains.
Yeah, I can just add.
Please.
Yeah. Thank you, Dr. Gore. That was such a great update on what you shared. And I would say one of my friends would say exactly the same. There is a residual weakness that cannot be explained. It's as if the whole energy is sucked out suddenly. And we have not understood COVID at all. I would say we are only 6 months in this pandemic, March to September. But as Dr. Gore from Sati would say, our Dr. Sunanda Gore, do we have any data on South Asians on COVID? And that makes me take a step back and think, I know that American Heart is collecting data. I know CMS is collecting data. But do we have any data in our South Asian population? So we are not yet there. We have a long way to go. But this is an opportunity to actually create a survey and ask everyone, can you take this survey? Did you have COVID? Do you have so-and-so symptom? So we have this opportunity to start it right now and ask questions very pertinent to South Asians, because we are genetically, culturally, we have different components compared to Caucasian population, and how we react to COVID compared to how the Caucasian population is reacting to COVID may have different outlook, in the outcomes, when we look at the outcomes. So we have this opportunity to indulge in a research, a question, and that can emerge out of this discussion and say, what are the symptoms that can be seen 6 months from now? How did it start? What were the comorbidities? Because we have really not looked at COVID and South Asian component yet, and we need to start somewhere. And a couple of my patients or a couple of my, sorry.
No, just to add to the point, there are certain physician group. We are looking into COVID and South Asians, COVID and South Asian men and women. So there is ongoing studies already going on right now, especially South Asians and COVID. So certain physician group, we are already working on that.
Wonderful. That's nice to know. I was not aware, so I asked. Thank you.
Well, no, maybe to Varsha's point, though, maybe this is a good opportunity to sort of get groups together, because if Hethel, if you are involved or you know doctors groups, maybe what some of the rest of us can do is provide a platform to get you more data points, right? Which is to get people to respond more to whatever studies you're doing, because the more participants, the better your results are going to be. So maybe that is something that we can do post this panel, work together to provide you guys with more data points.
So these are national physician organization, and what individual physicians are giving their experiences with their population, and we are gathering data and analyzing it. So if we expand it further, then definitely I think and I'll after post this seminar offline, we can talk among our ISA group, and we'll definitely follow up.
That's wonderful. So I'm very cognizant of the time. I know we have some questions and comments, so I want to get to those, but there are two specific things I want to touch on briefly, and maybe we need a whole other panel to expand on it. But I would like you all to address the fact that there seems to be increasing alarm bells being rung about a COVID winter surge. And you see various responses to that in the public, right? Because restrictions are easing, people seem to be more comfortable, and I think they're getting a little lax. And to Hethel's point, it's wonderful, and I think we should be telling our young people, get some of your energy out, go outside. But as we enter the winter months, that's going to be less and less an option, right? And from what I'm hearing, we're going to be telling people shelter in place more, restrict your movements more because of this potential winter surge. So first, can you, any of you address what you're hearing about that, and what do you think is the best way for us to really get the New Jersey community and then our South Asian population to take this seriously when there's seems to be so much COVID fatigue setting in? So I don't know who wants to handle that first, but Devanji, go for it.
So with what we're expecting in the fall is increase in flu cases, and pair that up with COVID cases. One thing to remember going back to March was that was the tail end of flu season, and we saw high levels of illness and death compared to the normal as it related to COVID. Now, if just imagine if we were into flu season and that was happening. That's a nightmare scenario, and that's something that we are concerned about for fall. That colder temperatures, and now they're going to get indoors. Have some big cultural holidays a flu vaccine that might make it a little bit easier for them to diagnose the illness. The other thing too, to the difference between COVID and flu is that, flu, you tend to get sickest within the first week of illness. Whereas COVID, you're not experiencing the worst symptoms until the second or third week. So that's, those are some of the big differences. Again, I was university, and I'll leave it up to the clinicians to talk about the details.
Thank you, Deva. I think you made about flu vaccine. I can emphasize that just walk into any pharmacy. It's free. What to do is take, and you have to have readiness for that, because right now it's this season we are going to deal with two viruses. One is flu and another is COVID. So if you are protected from one virus by taking flu vaccine, then you can practice all your preventative measures such as masking and hand washing. This was one of the message as a healthcare provider and a clinician and a nurse practitioner. We say it like a repeating record to all our patients. Please take your flu shot. Please take your flu shot every year. And it will protect you, because every year there is a new I think mutation of the virus. That's why they prepare the vaccine predicting that this will work for this season. Second thing, I am an Indian woman. I love all my festival. I have danced Navratri all 9 nights in Mumbai I came to this country just 22 years ago, but those festivals are ingrained in my blood and they flow in my veins every year. I wait for them. But this year I'm going Zoom, right, with my families. Diwali, I'm going to light my lamp in front of computer, celebrating with the family. These are some sacrifices we will make, and it will work in positive manner for us, because I will say in Hindi there is a word, jaan hai to jahan hai. That means if we have our life, we will celebrate it for rest of the life. So we have to be smart and patient. Patience is something that we really need, all of us. And to my South Asian community, I'm part of you. And I understand that some things are so important to us, but this year is different. And we have to work together in order to meet this challenge. So happy Diwali and happy Navratri and happy Kwanzaa and Christmas. I think we have every festival, Thanksgiving and Halloween. When I was thinking of Halloween, I was just thinking, I hope we are not exposing to picking on candies. No, this gives me a little bit kind of, I'm in little bit of fearful state right now. So we all have to do due diligence, and we have to really take a step back and think, am I going to do this? Why should I do this? Can I wait for one more year? Everything is going to come back. So patience.
I agree with everything you said, Varsha and Devanji, and I will just say this: we're not a monolithic group, South Asians. We cover a number of countries, a number of religions, so many ethnic groups, and we all have celebrations. One thing in common, whether we're South Asian or not, and even in our South Asian community, people outside our community may not realize how many Christians and Jewish members of our South Asian community we have. We all seem to have major holidays in this late fall and early winter time, and it worries me. And I hope everybody realizes that if we care enough about our families and our communities, then we're going to have to make that sacrifice this year. And I will say this about Halloween: I am encouraging everyone to be creative. I was talking to a bunch of friends of mine with young kids, and I said, do a scavenger hunt at your house. Get candy and create something for your kids rather than have them go door to door where there could be more potential spread. But I'll say that. And then the other point I wanted to address is you made a point about the flu shot being free. And one of the things that concerns me is maybe an outside perspective of the South Asian community is everybody's a doctor, everybody is a IT exec, everybody's got money, and there are a lot of people in our community who come from a lot of different socioeconomic backgrounds. And so I just really feel like we need to spread the word to the entirety of our communities that there are these resources. Free flu shots at the pharmacies. I know in Middlesex County, and I know many of the counties, the COVID tests are free. And you just have to go on the website of your particular county and find out when you can sign up for a COVID test. Because for anyone involved in any public health aspect of this, we know that the one way we can beat this is with testing, tracing, and then eventually a vaccine. So let me ask you this. There are a number of different vaccine trials going on all over the world. And one of the things I hear is that many of the trials are having difficulty recruiting participants from minority communities. So can any of you speak to why that's so important? I think many of you kind of touched on it, and people watching this may understand why it's so important that we encourage members of the South Asian community to volunteer, if you're able to volunteer to participate in the clinical trial. So
yeah, I can just bring the message from Dr. Sananda Gore, who is our director of South Asian Total Health Initiative. First thing, that there is a vaccine trial on its way at a super site, and that's Johnson & Johnson vaccine trial coming to Rutgers. This is only one dose of vaccine, and and so volunteers participate. The link, I'll share it with ISA or members so that you can put it on the website. But it's really important to know how South Asian community is reacting to this vaccine. If we do not have any South Asian volunteers, then we will really not find out the efficacy and how they are developing antibodies after receiving the vaccine. That's why it is important that we need to have a larger number of South Asian volunteers to participate in this vaccine trial. I think that's how we will be able to have a comfort zone in future that yes, this vaccine is effective and I can take it.
Shanti, to answer your specific question about why there is a reluctance in South Asians to volunteer, it goes many folds, correct? Number one, some of us are very much against vaccination. So that's one of the reasons they are not very willing, right? Number two, there has been a big history of abuse that has happened. If you go back, WHO, United Nations, when they used to come to vaccinate, right, it was for a good reason. But in people's mind, they thought that they were giving them, their kids, this vaccine and putting something else in it. So there's this kind of, the trust is a big issue. And especially in South Asians, because we feel like we don't want to be guinea pig to something that we have no control over, right? So that's another fold why South Asians tend to be a little bit, the trust is a big factor. Conspiracy theories, right? There are lots going on WhatsApp about why and what. So we're a little bit vulnerable because of education level of across the board is not as much. And that kind of gives a lot of this kind of questions and trust to the vaccine. And like any other community, we are all still skeptical about the side effects and potentially what it can be. And why should I be the one to take, have that? So those are few of the reasons that people have this, reluctance to join the trials. So we are no different than other communities. I think a lot of communities have similar question about participation, but there is some ethnic reason and there's some history that kind of is embedded, and we are a little bit skeptical.
No, and I agree because the historical perspective, it's ingrained, and people hear stories from their families, from everything from TB and typhoid and everything else. That's even things that went on in India from my background. But I think that what that speaks to is the more people that we have within our own community who can be the ones communicating it, who are the experts and can show their bona fides and can show that they understand where these fears originate. Perhaps maybe we can do something to help dissipate, that distrust and those fears. So I think it just calls upon all of us who are in positions to at least make the effort, right? Because
right, the burden is on us right now to educate people. Absolutely.
So I'm going to ask a couple of questions that we got, and one of them was regarding contact tracing in schools. Like, how, is that in place across the board in the state, and how is that working? Mm-hmm. So I don't know who wants to take that question. Colleen.
Yeah. Deb, you wanted to say something earlier.
Deb.
Do you want to?
No, it's okay. Go ahead.
Yeah, sure. And I'll will quickly defer it to Devanji, because at the local public health level, I know they have very, very close working relationships with the school nurses who are really kind of a part of public health, truly. But I can say just more broadly, contact tracing is contact tracing, whether it's happening if there's a case in a school system, if there's a case in a workplace, if there's a case that's a hospital employee, it's the same process that takes place. It's still reported through local public health and governmental public health based on residents. Contact tracing is kicked into place in case investigation, regardless of where that individual is based, regardless. And I'll turn the specifics of the school to you, Devanji, just
Sure.
in terms of working with the nurses there for added.
Yeah, so with regards to contact tracing, the state has, broad guidelines for what schools should do, but there are details when it comes to contact tracing that a school district should be working very closely with their health department. And we know that there's some school districts that are in person now, but there are others that are still virtual. So it's very important that they are communicating with their health department and that they have a plan in place when it comes to identifying students that may need to be quarantined, but then also being able to quickly identify any siblings that might be in the household, keeping track of where students are in a classroom, always knowing who that cohort is, that consists of either, if it's a block A or a block B schedule, the goal is to not be a close contact in a school. So you want to make sure that there's masking and social distancing happening all the time. But when it comes to classrooms, for the younger kids, it's easier to do contact tracing because they're most likely going to be in one classroom. But it gets complicated when we're talking about middle school and high school because these students are changing classrooms. So it's important for school districts to have documentation and procedures in place so that they can quickly identify who was in a classroom, what staff, are staff changing rooms as well? What are the seating arrangements like on school buses? Are we able to quickly identify who was on a bus? Things like that. And it has to be the same for students and staff. And those specifics, again, will be between the school district and the health department. So, if you have any questions regarding school district plans, it's best to reach out to either your Board of Education or your local health department, because the contact tracing plans will vary based on the jurisdiction.
So Shanti, if I could just add to that, it's important to know that contact tracing will remain the responsibility of the local health department. It's done in conjunction and in cooperation with the schools. Schools may do notifications. So you may get a notice from a school saying there's been a report of a positive case or more than one in your school, but the specific people who may have come in close contact, and close contact is defined as 10 minutes or more and less than 6 feet. It's a very specific definition. That will still come from health department. And I emphasize that so that parents and so the school communities know that there's the respect for your privacy there. The schools the school may know who the child is or the staff because they're out sick, but the school is not sharing that information directly with other people. That is protected health department work. And so they should understand that if they hear a message from the school, but they don't get a call from the health department, that's because they've been notified and that's all that needs to be done. But if they get a call from the health department, it comes as a partnership with the school, and they should, of course, take it very seriously.
Thank you for that additional information. So we're coming up at the very end, and I'm going to thank all of you so much for participating. As I said before, your perspectives are amazing and unique. I think one of the things I'm going to, many people have mentioned in the chat, different things that we can do. In terms of everybody taking care of their individual health, whether that's through proper diet and exercise and awareness, and then also the masking and the social distancing, and remembering that just because we're related to blood does not mean that we share an immune system, and that somehow someone being my cousin doesn't mean that cannot be transmitting between each other. The one other thing I think I want to just stress is we all go out. We have a lot of people in our community here in New Jersey, especially, who aren't citizens, and they may be here as green card holders, visas, or they may be here undocumented within our community. And I really want to stress the fact that COVID does not care if you're a citizen or not a citizen. The health officials in this state don't care either.
That's right.
From the perspective of the medical professionals who are taking care of you and the public health care officials who are trying to stop this pandemic, our issue is you as a human being, and there are resources. We'll put them out on ISAW. There are people here on work visas, and we all know in our community, many people here are working, but they're not getting health insurance, and they may be making a nice salary, but that they don't have that safety net in terms of proper health care. they can get their flu shots free, they can get COVID tested, and there are so many resources, and we don't want to leave anybody behind. And I know as a group, ISAW is really committed to doing whatever we can to facilitate communications and information and resource sharing. And I know all of you wonderful women on this panel are willing to provide those informational resources, and we will share them. So I am going to once again thank everyone here for taking the time out on a Sunday night. And as Yom Kippur started, if anyone's listening who is Jewish, it is a very important holiday. So I thank you all for participating and realizing that, yes, as Varsha said, we are one community. Whether we are South Asian or non-South Asian, number one, we're New Jerseyans, right? And that's where we have to start the base, that all of us in New Jersey have to take care of each other. So on that note, I am going to sign off, and I'm just going to ask Suchitra and Kiran, is there anything else in regards, perhaps the two of you, please, if you could repeat our Facebook site, our email site for anyone who wants to go on and get some more information, which I hope we can get up within another day. Suchitra.
Yes, thank you so much, everyone. Our Facebook page is facebook.com/isaw.official. I also put that in the chat. And our website is isawnj.org. Please let us know if you have any more questions about this panel, or if you want to see a certain topic for our next panel. Thank you so much.
Thank you so much.
Thank you. Bye-bye.
Bye-bye. Have a good evening, everyone.
Thank you. Good night.
Everyone.
Good night.